Whether you're having an arranged cesarean section or an emergency cesarean birth, the process can be daunting, especially if it's your first time. In fact, I remember my first time very vividly, not knowing what actually I'm doing, looking confused and awkward, and shifting my gaze away from the person in front of me. Sorry, that's a video for a different time. I hope knowing who to expect during the most important day of your life will help make the process less intimidating, which means more time for you to spend on the more important and fun aspects of childbirth. So let's get to it. Most of the time, the operating table will be at the center of the room because you will be at the center of our attention. On one side of the room is the neonatal resuscitation machine, and it's there for the infrequent event that the baby needs help soon after birth. In most cases, you will be able to have your birth partner attending to you during the procedure. The rare exception is if you were to require a general anesthetic. We now move on to our neonatal team. They are usually doctors, but they can also be a neonatal nurse specialist or a nurse consultant. They are only present if there is a higher than usual chance that the baby may require attention after birth. For example, a baby with suspected heart or lung problems, or a baby who is in distress during labor. At the head end, you will find the anaesthetist, and oftentimes accompanied by an anesthetic nurse or operating department practitioner. They're flanked by an anesthetic machine. They'll be keeping a close eye on your observations and making sure that you're managing well during the ongoing operation. They also ensure that you're given the medications and fluids in a timely manner to minimize the risk of complications arising during the procedure. More importantly, the anesthetic team is charged with other vital responsibilities during the birth of your baby. If and when it's safe to do so, they are also your main photographer for those great family shots of you, your baby, and your birth partner. They're also our in-house DJ, so don't hesitate to inform our team if you have a playlist in mind. And then we have surgeons like myself who are present to perform the operation to birth the baby. And next to every good surgeon is a great scrub nurse, and I have the privilege of working with some of the best. They ensure the equipment we use are where they should be, and they can read my mind and anticipate what I need before asking. Next up is the runner. They are either a nurse, ODP, midwife, or midwifery support worker, and they help to ensure any equipment required during the procedure can be collected. Now we come to the midwife, and you will meet them before, during, and after the operation. They can support you with holding the baby, aid with breastfeeding, and do regular checks on you and your child once you've left theatre to make sure that everyone's doing well. If your pregnancy is booked at a teaching hospital, there may be students on rotation in maternity care. They can be from different disciplines, such as medicine, nursing, midwifery, as well as paramedics in training. Indeed, they may be caring for women who are pregnant in the future, so it's useful for them to be exposed and witnessing births at the operating theatre. However, it's important that you're comfortable with having additional personnel during your procedure, and we will always ask for your consent beforehand. As you can see, there are a number of individuals present during your operation, all of whom will have specific roles and tasks to ensure the procedure runs safely and that any complication which arises are dealt with swiftly. I hope this is useful, and don't forget to give this video a like. If you wish to know more about cesareans, I have a video for that. Share this with friends and family whom you think will benefit from this information. Be sure to subscribe to the channel, and I'll see you again soon.